Okay. Whenever we talk about any malignancy, if we try to understand conceptually that how this cancer is going to spread, so one thing that you have to remember, beta, any cancer can spread either locally or through lymphatics or through blood. Now, when we say locally, means in the adjacent areas. So we know that these malignancies, suppose in GI tract, carcinoma is something which is arising from the mucosa. So if you take a look at the layers of GI tract, there is mucosa, submucosa, muscle, and wherever there is peritoneum, like in the abdomen, inside the peritoneal cavity, wherever there is peritoneum, outside the muscle layer, there is serosa. So if you look at the GIT, the mouth, pharynx, esophagus, they will not be having serosa, but esophagus, stomach, duodenum, jejunum, ileum, colon, and the upper part of the rectum, that would be having the serosa. Okay, and then the lower rectum and the anal canal will also not be having the serosal layer. So the different layers, mucosa, submucosa, muscle, and wherever there is peritoneum, there is serosa. Wherever there is no peritoneum, then instead of serosa, it is adventitia. Okay, fine. So locally, the oral cancer will be spreading from the mucosa into the submucosa into the muscle, the adventitia and the adjacent organs. The same story with the esophagus, same story with the lower rectum and the anal canal. In the stomach, duodenum, jejunum, ileum, colon, and the upper rectum, it will be mucosa, submucosa, muscle, and serosa, and then to the adjacent organs. Right? Okay, through lymphatics. Through lymphatics, the story will be spreading into the lymph nodes. For example, just for our understanding, if we take a look that this is suppose the ascending colon, the cecum, the transverse colon, the descending colon, the sigmoid colon, the rectum, and the anal canal. We know there is a fan-shaped organ that is a mesentery, and mesentery is actually supplying blood. Basically, if this is the mesentery, then the arrangement of blood vessels in this would be somewhat like this. Okay, and when we are talking about the lymphatics, then suppose I say that just look at the screen, beta, just try to understand the concept. If I say that there is a cancer in this area, then how this cancer will spread into the lymphatics? First, it will be going into the lymph nodes which are lying very close to this area. Okay, so there is a possibility that the epicolic lymph nodes, or the lymph nodes which are present on the wall of the colon, they are going to get involved. The lymph nodes which are situated next to this, that is paracolic, they are going to get involved. And then the lymph nodes which are present on the blood vessels which are supplying blood, then they are going to get involved. If I use another color to make it look better, for example, these are epicolic, these are paracolic, and these are intermediate. So that is how the cancer cells are going to spread through these lymph nodes. Okay, first this is going to get affected, then this is going to get affected, then this is going to get affected. Now, gradually, the lymph nodes which are situated on the major vessel, like this part, this is hindgut. So if you look at the basic anatomy in GIT, the foregut, midgut, and hindgut, the principal vessel supplying blood to this, foregut celiac trunk, midgut superior mesenteric artery, and hindgut inferior mesenteric artery. Lymph nodes are situated along the blood vessels. So any malignancy, look at me on the screen, any malignancy in the foregut, the principal lymph node involved will be the celiac lymph node. Any malignancy in the midgut, the principal lymph node involved will be the superior mesenteric lymph node. And any malignancy in the hindgut, the principal lymph node involved will be the inferior mesenteric lymph node. I hope this is clear for understanding. Right. Okay. Another thing. If we talk about the oral malignancies or maybe head and neck area malignancies, then these malignancies, they drain into the cervical lymph nodes. Let me just come on the big screen and try to see, just a moment, because this is important conceptually. So let us just try to understand it even better. Okay. So just look at me on the screen, beta. If we are talking about the head and neck cancers, any head and neck cancer, this is going to drain into the cervical lymph nodes. Okay. Any malignancy which is related to the upper limb or maybe the breast area, that is going to drain mainly into the axillary lymph nodes. If we go inside the thorax, this is going to drain into the mediastinal lymph nodes. If we talk about the stomach area, then the principal lymph node involved is the celiac, the midgut, superior mesenteric, hindgut, inferior mesenteric. Okay. If we talk about the kidneys, they are retroperitoneal, so there will be regional lymph nodes here, so they are going to get involved. Now, if we come into the pelvic area, beta, inside, pelvic area inside. Now, pelvic area inside, beta, if we try to take a look at the blood supply, you know that you all have got a wonderful heart. Yesterday was a Valentine's Day. Wish you again a very happy Valentine's Day. Hope you would have celebrated it nicely. So we all have got this wonderful, beautiful heart. And we know that there is aorta coming out. So the aorta ascends upwards, arches, descends, and then it pierces the diaphragm at the T12 vertebral level. We know there are 3 openings in the diaphragm, remembered by the mnemonic Voice of America. V, vena cava, O, esophagus, A, aorta, T8, T10, T12. So vena cava T8, esophagus T10, and aorta T12. So this at T12 becomes abdominal aorta. And at the level of 4th lumbar vertebra, the abdominal aorta divides into common iliac. Common iliac divides into external iliac, internal iliac. Internal iliac is the vessel, principal vessel, which is going to supply blood to the pelvic organs inside. And the external iliac will continue down into the lower limb as femoral artery, popliteal artery, anterior posterior tibial, and dorsalis pedis artery. Okay, beta? So this is just the arterial tree distribution. Now, if we are talking about the pelvic organs like urinary bladder malignancy, so since bladder will be supplied by internal iliac, so the principal lymph node draining the urinary bladder will be the internal iliac. Same way prostate gland, principal lymph node involved will be internal iliac. Though on its way to internal iliac, there are obturator lymph nodes. So first obturator lymph nodes get involved in prostate cancer, and then the internal iliac lymph nodes get involved. Okay. If you look at the penis, now penis is beta outside. It is not inside the pelvis. It is outside. So any area right from the lower limb or maybe the perineal area which is on the outside, that is drained into the inguinal lymph nodes. So penile cancer, lymph node involved will be inguinal lymph nodes, right? Testicular cancer. Now in testicular cancer, beta, the anatomy knowledge says that testicular artery is a direct run from the abdominal aorta. Though what we know that all the internal pelvic organs, they are supplied by the internal iliac. But a word of caution, beta, testis and ovary, gonadal artery, that is not a branch of the internal iliac. That is a branch of the abdominal aorta. That means if there is a cancer in the testis, it is not going into the internal iliac lymph node. It will be going into the pre-paraaortic lymph nodes. Okay. Inferior vena cava is situated slightly onto the right side. If it is the right testicular cancer, then the lymph nodes involved will be between the inferior vena cava and the aorta, aortocaval or interaortocaval. If it is the left-sided testicular cancer, this will be going into the para-aortic lymph nodes. Para-aortic lymph nodes. Okay. So testicular cancer में ध्यान रखना बेटा, गलती नहीं करना. ये this question was asked on 20th of January also. Which lymph nodes are involved in testicular cancer? And there the answer was para-aortic lymph nodes, right? They asked about the left testicular cancer and it was the para-aortic lymph nodes. If they ask you the right testicular cancer, the best answer would be intra-aortocaval. That means between the vena cava and the aorta. Please remember, testicular artery is a direct branch of abdominal aorta. Testicular artery is not a branch of internal ilia. Uterine artery is a branch of internal ilia. Ovarian artery is not a branch of internal ilia. Ovarian artery is a direct branch of abdominal aorta. Please beta जी गलती नहीं करना इसमें, हाँ. I hope you will remember this. चलिए, so thyroid malignancies if we talk about, they'll be going into the neck lymph nodes. Okay, एक बार फिर से let us understand this concept once again and then we'll see कि which cancer will go into which lymph node. ठीक है बेटा, चलो फटाक से करते हैं इसको. All the head and neck, cervical lymph nodes, thyroid, cervical lymph nodes, the entire upper limb, the breast, mainly into the axillary lymph nodes, esophagus, mediastinal lymph nodes, stomach, celiac lymph node, midgut, superior mesenteric lymph nodes, hindgut, that is colorectal area, inferior mesenteric lymph nodes, right? Now, if you go into the kidneys, kidney would be going into the regional lymph nodes in the retroperitoneum. Then urinary bladder, internal iliac lymph nodes, prostate, internal iliac lymph nodes, between that there is obturator lymph node, penile cancer, inguinal lymph node, testicular cancer, para-aortic lymph nodes, left testicular cancer, para-aortic, right testicular cancer, intra-aortocaval. Okay, fine. So all the malignancies what we are supposed to discuss, if you have this concept nicely, then it is very easy to answer this lymphatic spread, right? एक बार quickly बताओ बेटा, मुंह से बोलना है, speak out from your vocal cords. Head and neck cancers, very good. Oral cancer, very good. Thyroid cancer, very good. Breast cancer, very good. Stomach cancer, midgut cancer, hindgut cancer, very good. Kidney cancer, urinary bladder cancer, prostate cancer, penile cancer, testicular cancer, left testicular cancer, right testicular cancer. Wonderful. एक बार दोबारा से करते हैं. Let's do it once again. Head and neck cancers, thyroid cancer, oral cancer, breast cancer, esophageal cancer, stomach cancer, midgut, hindgut, kidney, bladder, prostate, penis, testis, right testis, left testis. Very good. Wonderful. So I hope you will remember this concept. Now same concept applies in blood spread also, beta, that how the cancer is going to spread through blood. So if you carefully take a look that the GI malignancies, for example, if I say what we try to do was we try to discuss the lymphatic spread. Now let's take a look at the blood spread of cancers. So again, I'm just trying to focus more on the conceptual understanding beta, so that if you get these concepts nicely, you're not going to miss out. Because in oncosurgery, once we are done with this, then it is the writing part only. Now here, we just discussed that there is a mesentery, which is actually having the blood vessels which are supplying blood. So now if we say that there is a cancer in this particular area, and this cancer has to spread through blood. So obviously, if you carefully take a look, the job of the artery is to bring the blood, while job of the vein is to drain the blood. Okay? Now if you take a look at this particular area beta, artery का काम क्या है? Artery is to bring the blood. Vein is to drain the blood. Now if I say that there is a cancer growing in this area, and these are the cancer cells here. Suppose these are the cancer cells here. Now when this cancer cell has to spread through blood, the direction of blood flow, if you look in the artery, the direction of blood flow is like this. While if you look in the vein, the direction is like this. So now beta, can you tell me if there is a cancer here, how it can spread through blood? Whether it will go into the artery or it will go into the vein. आर्टरी तो ब्लड लेके आ रही है, तो डायरेक्शन इस तरफ है, तो कैंसर इसमें जाने की कोशिश करेगा भी, तो आर्टरी से धक्का देके वापस भेज देगी. तो इस वेन से अगर बात करें बेटा, तो कैंसर आसानी से वेन के थ्रू चला जाएगा. सो व्हेनेवर द कैंसर हैज टू स्प्रेड, इट यूजुअली स्प्रेड्स थ्रू द वेन. नाउ इफ इन द एग्जाम्स द एग्जामिनर इज आस्किंग दैट which site would be the common for metastasis. Blood spread means metastasis. Okay, so which will be the common site? Now if we are talking about a hindgut, it is draining into the inferior mesenteric vein. So cancer is going into the inferior mesenteric vein. Now if I just try to take you in the anatomy here, suppose I say that this is the liver and this is the spleen. Then in the veins, the midgut is drained by superior mesenteric vein, the hindgut is drained by inferior mesenteric vein. There is a splenic vein which is coming here. The inferior mesenteric vein opens into the splenic vein, and the splenic vein joins with the superior mesenteric vein, and they both together form the portal vein, and portal vein is going into the liver. अब देखिएगा बेटा, if I say, let me write it also. If this is liver, this is spleen, this is splenic vein, this is inferior mesenteric vein, this is superior mesenteric vein, this is portal vein, right? If there is a cancer in the hindgut, hindgut is drained by inferior mesenteric, so cancer is going into the inferior mesenteric. That means this cancer cell would be coming here in the inferior mesenteric, and through this the direction of flow is like this, so it is going into the liver. That is why this cancer through this vein will be going into the liver. So the commonest site of metastasis of hindgut cancer will be liver. Now if you talk about midgut starts from third part of duodenum. So third part of duodenum, fourth part of duodenum, jejunum, ileum, cecum, ascending colon, and proximal 2/3 of transverse colon. All this area is midgut. So beta ji, if I say there is a cancer somewhere in the midgut, now this cancer would be going into the superior mesenteric vein. That means if the cancer is coming here in the superior mesenteric vein, the cancer is coming here in the superior mesenteric vein, it will be going again into the liver. So the commonest site of metastasis for midgut cancers would be liver. Colorectal cancers, beta. You would be surprised to know that 1/3 of patients of colorectal cancer, by the time they present to us, the cancer has already gone into liver. 33% of colorectal cancers, by the time they present to us, they have already spread into the liver. So the commonest site of metastasis in GI malignancies is liver. Okay, fine. If you look at any other site in the body, whether it is head and neck cancers, or maybe upper limb cancers, or the lower limb cancers, or the bladder cancer, or the testicular cancer, or anything, you know that all these areas are ultimately draining into the heart. For example, if you look at this head and neck area or the upper limb area, ultimately it is draining into the superior vena cava. Okay, and the lower limb or the pelvic area or the testicular area, these veins are ultimately opening into the inferior vena cava. For example, if I just try to take you into the anatomy here, suppose beta, this is the right kidney and this is the left kidney. Now you know there is the right renal vein, there is the left renal vein. Since inferior vena cava is situated slightly onto the right side, that is why the right renal vein is short and the left renal vein is long. So suppose this is the inferior vena cava, right? Also we know that testicular vein on the right side, the testicular vein opens into the right testicular vein opens into the inferior vena cava, but the left testicular vein opens into the left renal vein. Okay, so once again, carefully look at the screen. The two kidneys what we are seeing here, the right renal vein, the left renal vein, the inferior vena cava. This is the right testicular vein, this is the left testicular vein. Left testicular vein does not open in the inferior vena cava, it opens in the left renal vein. Okay, if I say beta that there is a cancer, or here suppose, let me just take it a bit down towards the testis, and suppose I say that this is the right testis and here it is the left testis. Okay, let us try to see where these cancer cells are going to go. If I say that there is a cancer in the right kidney, then these cancer cells would be traveling through the right renal vein into the inferior vena cava, right? If I say that we are talking about a left kidney cancer, now if there is a left kidney cancer, then these cancer cells would be traveling into the left renal vein into the inferior vena cava. Now if I say that we are talking about a right testicular cancer, so these cancer cells, they would be traveling through the right testicular vein, and right testicular vein is opening in the inferior vena cava. If I say that we are talking about a left testicular cancer, so now these cancer cells would be going into the left testicular vein, into the left renal vein and into the inferior vena cava. Okay बेटा, we are trying to understand the story of metastasis. Cancer blood में कैसे फैलता है, कौन से organ की तरफ जाता है, ठीक है? We are just trying to understand how the cancer metastasizes to blood. Which organ should be the common site of metastasis? Okay, we understood one concept that these cancers will be spreading through the draining veins, and then you have to just remember the anatomical knowledge. This vein opens where, right? जब भी एग्जाम में ऐसा सवाल आए कि ये कैंसर ब्लड से या मेटास्टेसिस के थ्रू कौन से ऑर्गन में जाएगा, तो बेटा उस ऑर्गन की वेन पे लटक जाना और उस वेन पे लटक के चलते जाना, और जहां वो वेन लेके चली जाए वही साइट होगी उसकी मेटास्टेसिस की, ठीक है? इन द एग्जाम इफ यू गेट अ क्वेश्चन दैट व्हाट इज द कॉमन साइट ऑफ मेटास्टेसिस ऑफ दिस पर्टिकुलर कैंसर, just hold on to the vein of that particular organ and just keep on ascending along that vein and see where that vein is ultimately opening. So that would be the site of metastasis. Abhi we are talking about this inferior vena cava. Ultimately you know this inferior vena cava is opening into the right atrium, है ना बेटा? Ultimately if you look at the chambers of the heart, the right atrium, the left atrium, the right ventricle, the left ventricle, right? And this is your wonderful heart. Now suppose I say that this is the right atrium here, this is a right ventricle here. So what we know about is that if there is a cancer which is traveling in the inferior vena cava, so ultimately whether it is inferior vena cava or it is superior vena cava, they are ultimately opening in the right atrium. That means if the cancer is traveling into these veins, the cancer would be coming into the right atrium. Now the problem here is that this heart, the cancer cell is coming to the heart, but the heart is continuously pumping, so the cancer cells will not find any place to stay inside the heart. They'll become continuously pumped out of the heart. So from the right atrium, the story will go into the right ventricle, and from the right ventricle, beta, you know there is a pulmonary artery. So this pulmonary artery, the cancer cells will be going into the pulmonary artery, and pulmonary artery is actually going into the lungs. That means these cancer cells would be actually going into the lungs. So lung would be the site where the cancer cells will find the time and the place to stay and multiply. That is the reason why, whether a cancer is coming through superior vena cava or inferior vena cava, it is going through this pulmonary artery into the lung. And that is the reason why lung is the common site of distant metastasis for majority of cancers. Okay beta, GI cancers mein you had a look, midgut, hindgut, going into the liver. Common site of metastasis of GI cancers, liver. Rest all other areas in the body, they are ultimately draining either into the superior vena cava or the inferior vena cava. So cancer coming here, that is going into the lungs. That is why all other areas in the body, the common site of metastasis would be lungs. Concept I hope you are able to understand. समझ में आया बेटा ये चीज? Very good. Apart from this, I would like to tell you बेटा, there are few cancers in the body which commonly spread to bones. Generally, the prostate cancer in males and breast cancer in females, they most commonly metastasize to bones, and that is because they are drained through a lumbar vertebral plexus of veins, which we call as Betson's plexus of veins. So these cancers are going through the lumbar or the Betson's vertebral plexus of veins, and through that, the cancer cells are going into lumbar vertebra. So prostate cancer, breast cancer, common site of metastasis, bones, lumbar vertebra. Apart from prostate and breast, even PBKBT, P prostate, B breast, KBT, kidney, bronchus, thyroid. Kidney cancers, bronchus cancers, thyroid cancers, they also commonly metastasize to bones. Okay, right? Fine. I hope you understood this concept nicely. Right. Now, beta, let me ask you. जैसे lymphatic का किया ना बेटा, वैसे अपन इसको करते हैं. Just the way we did for lymphatics, let us try to do blood spread or metastasis of cancers. Head and neck cancers, they are draining into superior vena cava, so lungs. Thyroid cancer, again draining into the superior vena cava, lungs. Apart from this, bones. Okay, fine. Breast cancer, ultimately it is going into the vena cavas, and there are perforators which are going into liver. So for breast, bones is the most common, then lungs and liver. Right. Apart from this, if we go down into the stomach goes into the liver as well as into the lungs. Midgut, hindgut malignancies are commonly going into the liver. Kidney cancer, so you know beta, kidney renal veins, they are opening in the inferior vena cava. So again, kidney cancer is going into the lungs. Apart from this, kidney cancer also goes into the bones. Right. Bladder cancer, internal iliac veins. Internal iliac join with the external iliac vein to form the common iliac vein, and common iliac vein joins into the inferior vena cava. So bladder cancer, inferior vena cava, again lungs. Right. Prostate cancer, most commonly the bones, and then the lungs. Penile cancer, again beta, ultimately it is opening into the inferior vena cava. So again the lung metastasis. Testicular cancer, testicular artery is a direct branch of abdominal aorta. Right testicular vein opens in the inferior vena cava. Left testicular vein opens in the left renal vein. So ultimately testicular cancer is also going into the inferior vena cava. So it is also going into the lungs. Okay, fine. हो गया. All the cancers which we were supposed to discuss, we've actually learned about the site of metastasis. Okay, moral of the story, in a crux, two things you have to remember: GI cancers, liver. Rest all other cancers, lungs. Bony metastasis are common in PBKBT. P prostate, B breast, A kidney, B bronchus, T thyroid. ओके, मुद्दे के 3 पॉइंट थे। कॉन्सेप्ट को बेटा अपने ठोक बजा के समझ लिया कि भाई कौन से ऑर्गन में मेटास्टेसिस होनी चाहिए, तो हमें तो उसकी वेन पे लटक जाना है, और जहां ये वेन खुल रही है वही उसकी मेटास्टेसिस है। ठीक है, वहां चाहे जितने मर्जी कैंसर पूछ मारे, वेन पे लटक के चले जाना बस। शॉर्ट में समझने के लिए, याद रखने के लिए क्या कर सकते हैं, जीआई के कैंसर है बेटा तो लिवर में घुस रहे हैं, बाकी किसी भी इलाके का कैंसर है लंग में घुस रहा है। कौन से कैंसर है जो हड्डी में ज्यादा कॉमनली जाते हैं, पीबीकेबीटी, प्रोस्टेट, ब्रेस्ट, किडनी, ब्रोंकस एंड थायराइड। नाउ आई से दिस इन इंग्लिश once again बेटा। We have understood nicely the conceptual story behind how the cancers are going to spread into the blood, how they are going to involve the distant organs. Now, what is the common site of metastasis? Just to remember, GI cancers, liver; all other cancers, lungs. Bony metastasis more common in PBKBT, prostate, breast, kidney, bronchus, thyroid. ठीक है बेटा, अब एक बार quickly I would just like to ask you and then we'll move forward. Okay, oral cancer, lungs; thyroid cancer, lungs; right, breast cancer, lungs, liver, bones; esophageal cancer, lungs, liver; stomach cancer, liver, lungs; mid-gut, hindgut cancers, liver; kidney cancer, lungs; bladder cancer, lungs; kidney cancer also to bones; prostate, bones, and also to lungs; penile cancer, lungs; testicular cancer, lungs. Right, and we are done. Right, wonderful. So this was regarding the story of spread of cancers. Till now, what we have learned in oncosurgery, we have combined all the cancers together, and we are trying to learn all the oncosurgery in one go. First, we talked about what is the type of cancer. Then we learned about the site of cancer. Then we learned about causative factors, risk factors. Then we learned about how the cancer grows, ulcer or a polyp or a growth. Then we saw how the cancer can present to us. Right. Then we saw how the cancer spread locally through lymphatics and through blood. Okay, fine. Now, how to approach these patients? August 23, when you are sitting in the OPD, patient